In this episode, you'll learn about how depression is defined, what demographics or what kinds of people are most affected by depression, as well as the role of circadian rhythms and the role of the HPA axis and different hormones, as well as the role of trauma in major depressive disorder. So, what is depression? Depression is a mental illness that is showing more evidence of being a brain disorder, that having actual biological roots in the brain, and it is very common, affecting around 4% of the population, according to the World Health Organization. This is 300 some million people, which is about the population of the United States. So all around the world, there are a lot of people very strongly affected by depression. So depression often refers to major depressive disorder, or MDD, which is usually characterized by a group of symptoms. And these can be depressed mood, where the mood is feeling down or sad or flat or numb. And then this mood can be accompanied with changes in interest. So oftentimes people will notice that they're losing interest in activities that they used to find interesting. They will sometimes notice that they're feeling more feelings of guilt. So this can also be sort of like worthlessness, feeling like you're a burden on other people, feeling really bad about the negativity that you're bringing towards people, or those feelings of guilt, worthlessness, like I started to mention. So this could be, feeling like your life is pointless, or that you yourself are worthless, or don't matter. Also decreased energy levels. So people will notice that they, just feel like they don't have the energy to get out of bed or to do activities that they used to enjoy doing. They may not feel like they have energy to exercise. And then changes in concentration levels is another very common sign. So people feeling like they all of a sudden can't focus on their homework, or more commonly that they're reading, and then they'll read several pages and then not be able to recall anything that they just read, or that they just watched a movie or something on the TV and they couldn't tell you what it was about because they had difficulty concentrating during it. And then changes in appetite is a very common feature. Usually people have decreased appetite in major depressive disorders, so we'll find that they lose weight over the course of a few weeks or months. They may lose like 5% of their body weight, which could be 10, 15 pounds. And sometimes people eat more, so that's also something that you can see. And then another common feature is what's called psychomotor agitation or psychomotor retardation, which is where people more commonly they feel like they're sort of trudging through life, like life is sort of mud and they're moving through it very slowly. And then finally, suicidal thoughts or ideas. People either having more thoughts about either dying, or about committing suicide, or taking actions to start to sort of move those things forward. So those are some of the features of depression, and there are many possible causes and sort of interlapping features with medical illness. So people with depression have more chronic medical illnesses like diabetes, hypertension, hyperlipidemia, which is like high cholesterol. Hypertension is high blood pressure. In addition, they've been found to have shorter telomere length, which is sort of related to the aging process. So there's many illnesses related to that. And then also there's a relation with sort of the mind-body connection, and this sort of heightened sort of adrenaline state that the body tends to be in. So sometimes people will notice that they have, when they're feeling depressed, or if they're feeling excessively anxious, they may, and they're often related, they may have changes in their bowel. So when we are feeling very anxious, or sometimes when we're feeling very depressed, and our body goes into this adrenaline sort of fight or flight sort of response, what happens is our blood actually shifts away from our gut and into our muscles. So we may feel our muscles more tense, and our intestines will actually move more slowly. And as a result, a lot of people get constipation. Some people will actually have diarrhea. So this would be what's called irritable bowel. And then there can also be more autoimmune illnesses related to this. So things like eczema, the autoimmune attack of the thyroid is common in people with depression. So that'd be Hashimoto's thyroiditis. So sometimes people will have low thyroid hormone, and actually that can actually cause some of the symptoms of depression. So it can kind of be like a chicken or the egg sort of issue of which is it the low thyroid hormone that's causing someone to feel depressed, or is it that the depression is and sort of the psychological distress is leading to the greater amount of autoimmune inflammation of the thyroid? It's kind of hard to tell. Many other illnesses as well are related. Something like multiple sclerosis as well. They're known patients with multiple sclerosis, which have sort of these different patches throughout their brain and their spinal cord that can become inflamed. They can have sort of these relapsing, coming and going periods of depression as well. Depression is also different between the sexes. So, in particular, depression is twice as common in females, well, almost twice as common. It's about 5.5% in women and 3.2% in males. And this difference is actually true across different cultures, different nations, suggesting that there really is a biological basis behind this difference. Taking a closer look, women actually get depression or they actually have specific depression-related illnesses that men don't experience. So things like premenstrual dysphoric disorder and things like postpartum depression. The interesting thing is that these illnesses, also with some mood changes that can happen after menopause, all of these are related to times when there's a decline in estrogen levels. So, for instance, in premenstrual dysphoric disorder, that is when estrogen is the lowest, is right around the time of menstruation. Similarly, throughout pregnancy, estrogen levels climb, and then right at the time of delivering the baby, they drop quite rapidly, and so then that maybe the basis for these mood changes. Similarly, in menopause, what's happening is the ovary is sort of it's sort of shrinking and not able to produce the same amount of hormones and estrogen levels. And there actually have been some studies that suggest that replacing the hormones in women who have gone through menopause may be preventative of depression. So that's to say that, when women are experiencing their estrogen levels die off as their ovaries shrink down in menopause, that if we could give them estrogen to replace what their body used to normally give them, then it may prevent some of these mood changes, some of these depression that these women experience. That's not without its own risks, though. So nothing that I'm saying on here is medical advice, and nothing that I would suggest. For instance, replacing with estrogen has certain cancer risks and certain clot risks associated with it. So it's something to discuss with your doctor. But nevertheless, there are these differences between men and women in depression, and they point to the fact that hormonal changes may be a significant part of the illness of major depressive disorder. Depression can also have different effects in the old and the young. So in particular, in young people, depression can be at a rate of around 2 to 4% in children and 8% in adolescents. It's very common in adolescents, in particular, those who have a history of trauma. So if they were ever physically abused or sexually abused, or even if they've experienced trauma like exposure to a natural disaster. Additionally, those who are overweight or obese, it's more common in adolescent females. In addition, those who come from a household that where their family members have a history of a mental illness or substance use as well. Also, those who have questions about their gender identity or sexual orientation are at higher risk of major depressive disorder. In the older population, it's interesting that major depressive disorder is actually less common as a percentage in compared to other demographics, but in older people, we see a greater risk in suicide. In particular, males are at higher risk of suicide. Those who are single and past middle age and who have a mental illness or a history of substance use as well are at higher risk. Sort of the more isolated an older male is really at higher risk of suicide. Females, on average, across age groups, they attempt suicide more often, but the risk of dying from suicide is higher in males who are kind of in that demographic that I was just mentioning. In addition, depression is more common in older adults who, as they have more chronic diseases like high blood pressure, high cholesterol, diabetes. This population is often taking multiple medications. So polypharmacy is when you're taking 5 medications usually or more at the same time. And so it's been shown that may be a contributing factor to depression in this population as well. So those are some of the differences between sort of age groups and some things to look out for. Another important feature of depression is inflammation. So inflammation is our body's response to invaders, to pathogens, to threats. So our bodies, as we were evolving as a species, we were exposed to a lot of bacteria, a lot of pathogens, a lot of parasites, and our bodies needed to be sort of the bodies that would continue to survive were those that had more of a response to these invaders. And so what happens in the response to invaders, to a bacteria or a parasite, is that our body notices that it's there, and then it will release some of these inflammatory cytokines, we call them, and some of these cell signaling proteins that help to bring our white blood cells, which you may have learned before are sort of like our body's army. They are cells that are sent out to go and attack this foreign invader and kill it. What's happened is that there's what's called an inflammatory bias in our bodies nowadays, which is that for so many years, for millions of years, the ones that continued to survive were the ones that created more inflammation. But this inflammation is being found to have more and more sort of negative impacts for our body's sort of long-term health and for our mental health. So there's been actually a few different studies that have demonstrated that there probably is a strong relationship, if not a causal relationship, to some degree between inflammation and depression. Namely, there are these 2 studies that were done where they were taking what's called an endotoxin. Or a lipoprotein. It causes sort of inflammation in our body. And what was done was this was given to a few people in the study, and then they were watched to see what their sort of mood reaction was to this. And actually, when the person's inflammatory scores were at their highest, so these are with things like interleukin-6 or with tumor necrosis factor alpha, when these were at their highest, that's also when they were reporting the most depressive symptoms. They were noticing that they were unable to sort of experience pleasure, that they were feeling sort of more socially disconnected. These were at the times when these inflammatory scores were at their highest. And the same was also done with a different inflammatory marker known as TNF gamma that was used to create this inflammatory response. So in general, kind of the more inflammation that the person had, the more sort of depressive that they were feeling. So in comparison to acute inflammation, this is likely more of an issue with chronic inflammation in the case of depression. And in that case, instead of acute inflammation, where our body's attacking an invader and the area turns sort of warm and red, as the infection's being attacked, chronic inflammation can actually have problems exerted onto the actual cells, the actual tissue, and these are some of the inflammation things that we're seeing in the case of depression, actual inflammation and effects of the brain tissue. Trauma relates to depression at least partially through the HPA axis. If you're in medicine, you may have heard of this before, or if not, you may not be familiar, but HPA stands for hypothalamus, pituitary, specifically the anterior pituitary in most cases, and then the adrenal axis. So it's hypothalamus in the brain connecting to the pituitary at the edge of the brain and to the adrenal glands, which sit on top of the kidneys. So these are three major hormone secreting structures in the human body that are related to our stress response, and a lot of what trauma is just exposure to a severe stressor, so something like sexual abuse, physical abuse, or being exposed to some sort of danger or threat that was really significant in your lifetime. So there's a strong relationship between this hypothalamus, pituitary, and adrenal axis with trauma and fear. So specifically, in this stress response, what's happening is the brain is feeling fear that can happen through the amygdala in the brain, which is closely related to the hippocampus, which is where we learn from, and then also to the hypothalamus that communicates with the anterior pituitary to release what's called ACTH. The ACTH goes down to our adrenal glands, and it tells them to start pumping out these hormones like cortisol. Cortisol is what's known often as the stress hormone, and it is important in sort of our body, preparing our body for this stress response. And it's been found that these elevated stress hormone levels, elevated cortisol levels, are related to depression. Namely, some studies have looked at primates, so like monkeys, and those who have been taken away from their mothers at an early age, they actually had higher levels of cortisol and more activation of their HPA axis, and acted in some ways that are similar to how humans act in depression. And similarly, another study of females who had a history, I believe, of sexual trauma when they were younger, they were found to have higher HPA axis activation in their adult years. So it's believed that this high cortisol level feature is a major biological feature of depression. An important feature of depression related to the HPA axis is neurogenesis. So neurogenesis is our body's ability to create neurons. This also relates to pruning. Pruning is our body's ability to get rid of neuronal connections and refine the strong and important neural connections. And this happens throughout lifetime. It's not just when we're young. Neurogenesis, the creation of new neurons, happens when we're in the womb, and as we continue to grow in life, there are little areas of our brain known as neurogenic niches. And these areas are around the hypothalamus and around the olfactory bulb in the brain. And they're little like corners of the brain where new little baby neurons are grown. And these baby neurons are an important part of our ability to maintain mental health. And in fact, there have been studies, in particular, there's been mostly mice studies to demonstrate the importance of neurogenesis. And in some of these mice, they demonstrated that they created less new neurons when they are exposed to a stressor. And then after being exposed to a stressor and creating less neurons, these mice actually displayed more of depressive like behavior. So there is some reason to believe that changes in this neurogenesis are related to depression. Additionally, the HPA axis, like I was mentioning, relates to that in that the HPA axis can get in the way of the creation of new neurons. In one of the mice studies that I was referring to, the mice that had problems with creating new neurons actually had elevated cortisol. If you remember, cortisol is created by the adrenal glands in the HPA axis. And this HPA axis hyperactivity, as well as changes in the gut microbiome, as well as inflammation, and the decreased production of some of these neurotropic factors, which are factors that are like Miracle-Gro for the brain, as they say. They help to create new neurons. So abnormalities in the neurotropic factors, these include BDNF is probably the most important or most well known, as well as, like I just said, inflammation, changes in microbiomes, and HPA axis hyperactivity can all have a major impact on our body's ability to create new neurons, neurogenesis. And like I said, it's likely that can be a biological aspect of depression as well. So another illness that is related to major depressive disorder is seasonal affective disorder. And seasonal affective disorder sort of reveals the importance of another biological function in humans, which is our circadian rhythms. Our circadian rhythms are our body's natural way of releasing hormones and changing our biology and our behaviors according to cyclical patterns that we have in our way of being. And most importantly, these are exposure to light, as well as our sleep patterns and our eating patterns. And so whenever we have changes in our light exposure and our sleeping and eating patterns, it can create derangements in our body's hormones, and as a result can result in some mood changes and more depression-like symptoms. So what's seen well, actually, to start with, what is our circadian rhythm? So as I sort of pointed to already, it is a cycle of exposure to sunlight happening in the morning, and then going away in the evening. And what's happening is that light exposure is actually directly inhibiting in our brains the pineal gland, which secretes melatonin, which makes us feel sleepy. And so when we're being exposed to light, that's blocking our release of melatonin, and when it gets dark out, then our body will start to release more of that melatonin, making us feel sleepy and being able to fall asleep more easily. And so what can happen in seasonal affective disorder is that we get some abnormalities in this light exposure piece of our circadian rhythms. So what can happen is if there are extended periods where there is very little daylight, people can either have too much darkness, or it can be the opposite, that spending all their time indoors during the winter with lights on can lead them to to their body not being able to release melatonin, and that can create these sleep disturbances and can also result in these mood changes. It's been noted before that around 10 to 40% of our gene expression is reliant on circadian rhythms. So this can and we already talked before about the importance of hormones in depression. So by having abnormalities in our circadian rhythms, we can have abnormalities in our hormone release, and therefore have abnormalities in our mood, and have a higher likelihood of developing depression.